Hi and welcome to our video on fertility. I'm Dr. Rachel.
And I'm Dr. C.
In this video, we are going to talk about fertility testing for men and women. Did you know that studies have shown that more than 80% of healthy couples get pregnant within a year of trying to conceive? So, if you've been trying for a year and are still unsuccessful, you may want to consider fertility testing.
That's right. However, couples over the age of 30 might want to consider testing after trying for 6 months instead of a year. This is because women ideally should have their babies before the age of 35 to minimize risk of complications. Some couples may want to test even before starting to try to conceive just for the peace of mind.
Fertility testing for women can be divided into testing for ovulation and making sure that the fallopian tubes and the uterus are healthy. A blood test for hormonal levels can give us an idea of whether or not a woman is ovulating. A more direct way to determine if a woman is ovulating is to do regular ultrasounds during the time she is expected to ovulate. Ultrasound scanning is also a good way to get an idea of whether or not the tubes and the womb are healthy. Sometimes, women may need a slightly more complicated test, called a histosalpingogram, or HSG for short, to see if her tubes are patent.
Fertility testing for men is much more straightforward. The one essential test to do is a sperm test, or to be more accurate, a seminal analysis. This test will be able to tell us not only if a man is producing enough sperm, it also shows if the sperm are swimming fast enough and are normal looking enough. Of course, if there are any abnormalities detected in a sperm test, the man may need other tests to find out what the underlying problem is. This may include blood tests for hormonal levels and an ultrasound scan of the testes.
Do not allow fertility testing to scare you. Most women just require a simple blood test and a painless ultrasound scan. These two tests are often sufficient to give you a good idea of your fertility.
It is even easier for men. Most men only require a simple seminal analysis.
To find out more about our fertility testing service, visit our website at womens-health.sg. Thank you for watching. I'm Dr. Rachel.
And I'm Dr. C.